Assam Medical College is the oldest medical college in the region of Northeast India. It was started as Berry White Medical School way back in 1900 by philanthropist Dr. John Berry White, and later on, 3rd November 1947, Assam Medical College and Hospital was established through a process of upgradation of the existing infrastructure. The Labs for Life is a 3-year project of the Ministry of Health and Family Welfare and the US Centers for Disease Control and Prevention, popularly known as the CDC. This project provides technical assistance and capacity building for quality in diagnostic services in 20 institutions across 7 states in India. The Labs for Life project started with a gap analysis study, followed by the disseminations of the observed gap analysis results among stakeholders and respective authorities.
As a nodal officer of this Lab for Life project, the day he received on 28th January in 2015, he got the communication from Dr. Goyal, and in the same day in the evening, organized a meeting with all the head of the department of this laboratory, that pathology, microbiology and biochemistry, and form a committee and assured to support whatever is required.
Only thing, they give us the know-how, how you can develop yourself as a model laboratory by it with your own resources. So say for example, when we were assessed by the expert team from Lab for Life, and they did the gap analysis, and after that, whatever the gap they suggested, we tried very honestly to fill up.
In response, the authorities of Assam Medical College started adhering to the trainings imparted by Labs for Life project.
Training program that they have been given to our staff. The expertise, how to sample collection, how to deliver, how to take it.
After coming back from the first TOT on Lab for Life project, actually we conducted various training programs.
We must improve ourselves, the techniques and the methods which training has been provided by the Ministry of Health and Family Welfare, that must be accepted. And modern and new things are coming up, and that should be accepted. It must be by training we can have this one.
Implementation of the identified gaps and advocacy resulted in dramatic positive changes. And for infrastructure expansion, construction of the central collection facility started.
The central collection center are being expanded and upgraded.
And I'm gladly say that we have got one banner, that is the collection center is done in the same roof, so that there is a convenience for the patient, for the staff, for the doctors, as well as the laboratory technician.
Earlier, collection of specimen used to take place in 3 separate areas. But now, the patients can provide their samples in a single centralized collection area, thus making life easier for both laboratory staff and the patients.
I submitted a lot of projects to Department of Biotechnology and Indian Council of Medical Research, from where I could buy a lot of equipments with the help of getting those projects from them.
Before Lab for Life project, while it was not started, then if we can compare, we can easily observe the development or upliftment in our laboratory activities. In relation to capacity building, we have also been greatly benefited. We started gradually, actually, one by one, stepwise, for good laboratory practice, say for standardization, calibration, and starting from sample collection in a proper way, without having any interaction in between collection, taking the sample.
We have started on this path of change with the help of the Left for Life project.
Also, reports are made available on the same day without any delay. Besides this, separate toilets for men and women have been constructed. Drinking water facilities and sitting arrangements have been taken care of, and CCTV cameras have been installed for continuous surveillance.
The most important of this is the refresher training program that we took for all the staff of the college in going to different wards, and it was held in very small groups. So all the people, they were concerned with the biomedical waste management, they participated, they had their reservations, they had their query, they consulted with us, we could give some solutions, and we contacted the authority also in some aspects, and we started to giving some solutions to them. So it was a very good experience for all of us, and just we could see the positive change in them.
If we want to compare before and after starting of a Left for Life project,
for change of any institution or any organization, what is required, a good leadership can definitely motivate his team to get full commitment from every single individual working for the college or the institution, so that they can get a change.
Prior to this project, Dibrugarh district had no proper fully functional biomedical waste management facility. But now, Assam Medical College has successfully upgraded and constructed one, as per the Central Pollution Control Board and State Pollution Control Board guidelines. Industrial-grade personal protective equipments, appropriate vaccinations, and other safety precautions are ensured for every working staff.
All the BMW staff are being vaccinated against hepatitis B.
To sustain, once the system has developed in order, it has attained a good level. Generally, people working there are already motivated. They understand how to sustain that. And regarding financial part also, so we have to develop a scheme so that we are always self-sustained without depending anywhere to anybody. We can sustain the system for long, forever.
The three most important upgradations that took place in the biomedical waste management plant are the effluent treatment plant, autoclaving, and incineration. The tanks of the effluent treatment plant are well equipped to convert dirty water to clean water, which can be used for almost all non-drinking purposes such as cleaning, washing, etc. The biomedical waste is treated by autoclaving and shredding. Revenue is generated through selling and recycling of the plastic waste. Medical waste is treated at the incineration plant, strictly adhering to the gas emission standards.
I can proudly say that this BMW, which is present at Assam Medical College, Dibrugarh, is one of the best BMW projects in India, you can say. Because we have all facilities, we have all revenues, and now we are going to do the modernization, improve much more, so that the BMW is being the prime importance in the medical college and hospital. I will say that in other parts of India, they should make or they should arrange such a BMW project so that the hospital is benefited and other hospitals nearby, they will be benefited, and we will have a modernized systems in the country.
For future times, Assam Medical College is also considering plasma pyrolysis to replace incineration.
We will not stop here. We will go ahead. If there are newer methods are coming up, if there are newer activities coming up, we will accept it.
The change has just started. So with the help of everyone, every resource person, the help from the government and help from the other agencies like Lab for Life and CDC like this project, we can sustain it. And ultimately the government definitely will have to support us in continuing this change.
Three key persons play a very important role to create such type of conducive environment. Head of the department, head of the institute, and just immediate representative of the concerned ministry.
Assam Medical College in Dibrugarh has taken up the mission of upgrading its quality of laboratory services after getting inspiration from the ongoing Labs for Life project. This project can be considered a grand success only when the other designated 19 labs in 7 states achieve their goals. Assam Medical College has achieved the status of a role model, and hopefully all others will follow suit.
I can see the lot of change that has come because of Lab for Life project and our help from our authority. All our colleagues, all were so positive in bringing out this change.
But this can happen only when there is leadership at each individual level, and thereby provide for the motivation to all staff to work together towards a healthier tomorrow.